So when we're looking to use the foam roller on the lower body, some of the big areas we're going to look at are going to be the quads, the glutes, the TFL and the IT band, so the outside portion of that leg. And then the calves for me are going to be another big one. We can do the hamstrings as well. So I'm going to show you how to go through with some of these and talk through the technique, what you should be feeling, and just how to manipulate your body a little bit. So let's start with the quads. There's two options. You can either do it with 2 legs or 1 leg at a time. So let's go with 2 legs. The key when you're doing foam rolling is being able to breathe and relax, because we are trying to calm the nervous system down to relieve muscular tension. So if we're not breathing, that's not going to happen. So all you're going to do is go through the full muscle length from the top of your knees all the way up into your thighs. So like I said, you can go with 2 legs. We're rolling up and down. Or you can go with 1 leg where you're going to move yourself a little bit off the roller, bend the other leg up, and we're going to roll all the way from the knee up into the hip, going through the full length of the movement. You can use your arms and your legs to control how much pressure is actually down on the foam roller. Remember, breathe, relax, let the tissue relax. You're looking for about 5 or 6 passes each leg. Next up is going to be the glutes. So we're going to set the foam roller down. You're going to sit on it, and whatever side you want to massage, you're going to cross over with that leg. Okay? Use your hand behind you for support. Your other hand can be on your leg if you need for a little support there. And all you're going to do is just roll back and forth. Again, trying to hit the full length of the muscle all the way down and all the way up. Breathing. The intensity here should maybe be 5, 6 out of 10. If you find you're clenching and you're really holding tension, it's probably just too much. So again, 5, 6 passes, switch to the other side, 5 or 6 passes. We don't need too much. Doing more is not going to get you more return on investment. So try and be efficient with it to get out of it exactly what you're looking for. So the next one is going to be the TFL, which is the muscle kind of that sits right here by your hip pocket, and it connects into your IT band, which can, if that gets tight, it can cause you a little bit of knee pain. So we want to get up into the muscle, and then personally, I just think it feels nice to go all the way down. So you're going to be sideways on this one. Bring your top leg over top so it's on the ground, and go down on your elbow. So again, we can use our elbow and foot to lever ourselves to take some of the pressure off that side. And again, we're going to roll all the way down from the knee up into that hip. If you do find a particularly tender spot, so for me, right about there is a little bit tender, I want you just to hold it. Take a little bit of a breath, signal the body that it's safe to relax, and then keep going with it. And just be nice and controlled. Again, I'm using my shoulder and my foot to keep the pressure off the roller. Again, we're looking 5 or 6 passes. Maybe you're going through breath cycles and you're looking for 5 or 6 good breaths while you're doing it too. That's totally fine. Next one for me is going to be the calves. So you're going to be sitting down on your butt. Foam roller is going to be underneath. There's 2 options here. We can either cross over and you just kind of roll back and forth, keeping yourself on the ground. This leg just applying a little bit of pressure down, where we're again rolling from right behind the knee, up in the big part of the muscle, down through the Achilles, closer to your foot. Okay. The other option that I personally like is if you find a particular tender spot, rolling a little bit from side to side. Okay, just keeping that pressure down. In order to do this, you may need to push into the ground and get your hips off the ground. For me, I'm off the ground a little bit and I'm kind of rotating. Okay, kind of relax, find another spot. Up here, I don't need to do it. I found the muscle, and you just kind of roll. So again, find a couple spots that are a little tender, 5 or 6 passes, move along. Like I said, you're going to want to do both sides, getting all the way through the muscle. And again, remember, you got to breathe. You got to signal the body that it's safe to relax so that the tissue can be nice and prepped for you. The last one is going to be the hamstrings. You're going to put it underneath the leg. Again, on this one, I personally like to cross it over. You can do both at the same time. I don't get enough pressure that way, so I personally cross it over just so that all the pressure is right on to the muscle. Again, if the intensity is too high and you can't breathe and relax, this is just going to be too much for you. So then this is when we would look to do this or some sort of other passive hamstring stretch. And again, we're going all the way from underneath the butt, coming down to the back of the knee as we roll through that one. So again, just to recap, we want to make sure we can breathe. If you aren't able to relax, it's too much intensity and you're not going to get out of it the desired effects. I want you to make sure it's 5 to 6 per. Doing more than that, spending 2-3 minutes per body part, it's too long. It's going to cut into your training time and you're really not going to get the desired effects. If there's particularly sore areas, kind of hold that spot, take a breath, signal the body that it's safe to relax. Doing this before your workout can really help you relax some of the tension if you're feeling a little bit of pain or discomfort. I like using it for that purpose because if we can decrease pain and get people moving a little bit better and pain-free, that's always going to be a win. We're always going to look for that option. Doing it after your workout too can help delay some of the soreness, but it isn't really going to help you recover faster or anything like that. So for me, the biggest way I use it is before my workouts. Helps me just get the tissue feeling good. Then it makes my body feel confident and ready to train. So give those a try, see what you think.